Well, let's get more on this now. We're joined by Rohit Malpani, Director of Policy and Analysis for the Doctors Without Borders Access Campaign. He's joining us live from London. Very good to have you with us on Al Jazeera. So I know that MSF, your organisation, uses PCV. Tell us how you use it and what this decision by the Indian Patent Office will mean for you and the many children you immunise against this life-threatening disease.
Thank you for having me here, and we are deeply disappointed by this decision. As an organization, we are providing the pneumococcal vaccine in emergencies around the world, and we have always been very sensitive to the cost of the vaccine due to the high prices charged by both Pfizer, which has won this decision, and GlaxoSmithKline, which also has its own pneumococcal vaccine. This is significant because for many years, both companies have been able to charge very high prices for the vaccine around the world. And this decision will allow Pfizer to continue to control the market in India and therefore also in other countries because India produces these vaccines for children all over the world, the companies in India, and therefore keep the prices artificially high. This not only has an impact upon our organization, but has an impact for many countries which have not introduced the vaccine due to the high price of the vaccine. Fully 1/3 of all countries have not introduced the vaccine because of the high cost.
I know that MSF doesn't actually believe that PCV meets the requirements to even be granted a patent. So why has the Indian government done this?
That's right. We don't think it meets the requirements. The patent which Pfizer has applied for, we think is trivial and should have been rejected. And in fact, it has been rejected by the European Patent Office previously and is currently being challenged in South Korea and the United States. We cannot point to the reasons why the Indian government has done this. We are very concerned that India, which has traditionally had strict standards for determining whether or not something deserves a patent, has suddenly reversed and gone in the wrong direction. And this not only portends a negative setback for children who require this vaccine, but is a serious threat for many other drugs and vaccines in terms of ensuring affordability, because in the future, the Indian Patent Office may start granting these trivial patent applications that keep low-cost medicines and vaccines off of the market.
What could this decision mean, for India? Because it has a very long history of producing low-cost medicines. It's earned the reputation of being the pharmacy for the developing world.
That's right. The practical impact here is in the future, as pharmaceutical companies file thousands of patent applications which should not be granted, we are deeply concerned that the Indian Patent Office will start granting these applications which keep low-cost generic competitors off the market. This not only has an impact in India, and this goes for the pneumococcal vaccine, but for many other countries that rely on exports from Indian generic companies for vaccines and drugs in order to provide affordable treatment to patients. This is especially, therefore, going to be important, again, not only for India's ability to provide low-cost access to drugs and vaccines, but for many other countries which can only afford to provide treatment because of the competition that emerges from India.
Could this decision be challenged, Mr. Malpani? As you mentioned, the European Patent Office in 2016 revoked it. It has been challenged in South Korea before the US Patent Trademark Appeal Board too.
Yes, we are going to challenge this decision immediately, and we expect that some of the other companies and applicants which were challenging Pfizer's application will also seek to overcome this decision. And this is essential because really there is no other route to ensure that we have low-cost access to these vaccines. If Pfizer succeeds in maintaining this patent, there will be no competitor on the market potentially until 2026, which is far too long to wait.
Mr. Malpani, it's great to get your thoughts on this. Rohit Malpani from Doctors Without Borders joining us live from London. Thank you very much.